Good afternoon, everyone. My name is Kazibo Haman. I'm a physiotherapist by profession, but I'm a lecturer and also head of department of physiotherapy program at MAST. One of the things that we are going to be talking about today are the conditions that require physiotherapy and actually what physiotherapy is. Physiotherapy is a healthcare profession that aims at improving the functional level of patients who have been affected by trauma, by disease, to bring them back to their normal function or near to normal. And it mainly uses physical agents to bring about this rehabilitation of patients. All of us at one particular time we need physiotherapy. Whether we are normal, we don't have any disease, or when we are affected by disease, we are admitted. Even after admission, when we are discharged home, in order to bring back our function, then we need physiotherapy. So what are some of these physical means that we commonly use for treatment? So we commonly use heat. It has been used for a long time, right from time memorial. We use electrical physical agents like modalities that use electricity to stimulate muscles, which are important for our motion at joints. Also use ultrasound, which is also a modality that has been used for diagnosing specific diseases, but for us on our side, we are using it mainly for treatment or therapeutic purpose. We use other modalities like shortwave diathermy, we use shockwave, and a number of other new modalities. Other interventions that we also use for rehabilitating patients include use of exercises, and these mainly aimed at improving the strength of the muscles, but at the same time also improving the range of the joints that are usually affected by disease or trauma. If these joints become stiff and they are unable to function in the way they used to function, then physiotherapy is very important. Now, we have a number of conditions ranging from children, teens, middle age, and the elderly that we deal with. And some of these conditions include or they fall within, a large percentage of them fall within non-communicable diseases. Now, with those non-communicable diseases, there are conditions which are brought about by our style and way of living. These are conditions which cannot be passed on from one individual to another, but because of the social life, our way of living, predisposes our bodies to such conditions. Now, some of these conditions include diabetes, it includes hypertension, it also includes heart diseases or kidney diseases. Also, some types of cancers are also grouped in non-communicable diseases. Now, one would ask, what's the relationship between non-communicable diseases and physiotherapy? Now, it has been found that most of these conditions are brought about by sedentary lifestyles. Sedentary lifestyles is lifestyles which lack physical activity and predisposes us to a number of these conditions. Now, people who are physically inactive have been found to have high chances of being exposed to these conditions. And when I talk of physically active, means there is a certain amount of hours we are supposed to devote to some physical activity in the form of exercises for our bodies, so that we can prevent the occurrence of this disease. But a large percentage of the population, you will find that the number of hours that they devote to these activities is so minimal that cannot be regarded as true physical activity. Now, one would ask, if somebody is doing a lot of home chores every day, can this also be equated to physical activity? Now, we are supposed to be straining the body at a particular point with the physical activities for a certain period of time, so that it can be regarded as a true physical activity. If somebody is doing home chores, you may find that yes, he tires the body, but the amount of physical strain you are exerting onto the body does not reach the intensity that is required to be counted as a physical activity. Because in most cases, we are supposed to be putting in between 30 to 1 hour of moderate to vigorous exercises to be counted as a true physical activity. And most of the activities that we usually do at home are considered to be low intensity physical activity. So when we conduct such activities, we usually prevent. So if somebody is to acquire excess weight as a result of sedentary lifestyles, if we do a lot of physical activity, the body burns out most of those fats that would be bringing in a lot of problems. And secondly, it activates the muscles within our bodies so that they become strong. Once we have stronger muscles, we have healthy bones, strong bones that are able to hold our bodies without any problem. So once we undergo physical activity, that's when we try to prevent a number of those. Treating some of these conditions is very expensive, whereas prevention is the way to go. It is the cheapest way, which can be done by someone at home. We don't need playgrounds to do physical activities. We can do physical activities within our homes. We can do physical activities within our compounds, even within our rooms, as long as you've been designed types of exercise you can do, and then the duration of time you are supposed to be doing these exercises. So we can be able to guard a number of conditions. So we can reduce the intensity, for example, of hypertension. We can reduce the intensity of diabetes once we are physically active, but also it has been found that people who are physically active can guard against some types of cancers because the body is highly active. Now, physiotherapy is also very active in cases where we have trauma. Trauma is one of the leading causes of disability, especially in many developing countries, and the chief cause is mainly road traffic accidents. In our case here, border borders have been rated highest in causing much of the trauma. So we usually see fractures, we usually see dislocations, and when we have these cases, when they are reduced, then you end up having stiffness and then weakness in the muscles, which will require a physiotherapist to rehabilitate this person to go back to his or her normal function. So that is trauma. The other area is children. So we see, I've been talking of cases mainly that are affecting the teens and the middle age plus the elderly. But the children have a number of cases that usually require physiotherapy. And one of it is congenital cases, which children are born with, and especially those that affect the central nervous system, which includes the brain and the spinal cord. And these cause a lot of deformities and muscle imbalances into the children. And among these include cerebral palsy, which is a case that affects the young growing brain and usually retards the function of the brain. And we usually see manifestations in types of postures and then muscle rigidity or flaccidity that a child presents with. So with such cases, we've seen a number of them. We require physio. Now, physio does not treat the problem that has occurred to the brain. Instead, what happens that these cases or these conditions tend to retard the development of this child. So what a physio does is to educate this child through the normal development of growth, right from months of 3, 4, 6, 8, up to 10, or almost up to 1 year. So that's what we do, so that at least this child will be able to be independent. So he does not depend on others for some of the activities of their living. So those are children. There are a number of other cases which include structural deformities, which occur especially within joints. Still again, physios have a very big role to play. Then we have a number of other cases that involve structural deformities, especially with the spine. Still again, we have a lot of work that we usually do with those. Now, If I can sing out, those are the ones mainly in children. So in children, we have those cases that are that attack the central nervous system, that paralyze muscles and joint activity. But we also have cases that affect the musculoskeletal, that is the joints, the muscles and ligaments. And then lastly, if maybe I can briefly concentrate on some of the commonest that are out there. And one of the chief cause, one of the commonest is back pain. Maybe before I look at back pain, the other area that I'm looking at, especially when we are looking at cases of the central nervous system, is strokes. Stroke is usually brought about by increased pressure causing damage to a certain part of the brain, and then we usually have paralysis of one part of the body. Now that one is usually brought still about by a number of problems that are associated with a lack of physical activity, increased cholesterol within our blood vessels, which occlude them, and then blood finds it so hard to penetrate through the narrow lumen of the blood vessels. So this one increases the blood pressure, and then it ends up causing strokes. Now when somebody is affected by stroke, it's still again our role to rehabilitate this patient to see that the affected or paralyzed part is brought back to near to normal, almost to normal. Now, if I look at back pain occurs in all ages, and it affects a large number of the population, right from teens, middle-aged, and then the elderly. Now, the causes are different depending on the age bracket, but also the activity. Now, back pain, there are a lot of myths about back pain, which people need to understand, and some of these have even been brought up clinically among patients. One of it is sexual inactivity. There is a lot of myth about sexual inactivity and then development of back pain. It's known that in order for someone to develop back pain, you must have strained some structures within the spine, and this includes the ligaments that support the joints, the discs which lie between each of the bones of the spine, but also the muscles that are supporting all these. So if we do activities in particular awkward positions for a certain sustained period of time, then you overstrain these structures and develop into pain. Now if this is not checked, it goes from a week to a month, and then to months, then somebody will develop back pain. Now sometimes the other causes will be trauma. If somebody has been involved in accidents, either falling off from, let's say, moving border, falls down while seated, or is involved in a road traffic accident where cars roll off the road, or he jumps from a certain height, falls down while standing. All these will have impacts onto the components of the spine, which will predispose this person to back pain. Now, the last one is cases or conditions which affect the spine, which includes cancers, okay, which includes the degenerative changes or the aging process, which causes a lot of alternations within structures of the bones of the spine, which compress on specific structures and induce pain. Now, sometimes most of these things can be avoided, especially with the back pain. If you look at the structure or the sustained structure positions that we usually hold. For example, we have people who are seated in offices for very long hours. Somebody comes in at 8, he leaves the office at around 4-5, and he has left his desk ideally for like one time when he's going out for lunch. So he sits for almost 5 or 4.5 hours without changes. The amount of loading you put onto the spine will predispose it to a lot of mechanical problems that will induce pain. We have people who do activities in awkward bending position for a long period of time, people who lift heavy loads and carry heavy loads, especially on the head, will all load the spine and will induce pain. So what can one do? The simplest thing, that what can one do to prevent this, especially within our homes, within our work environment? The commonest one is if you are somebody who sits for long hours, you need to break that pattern. We usually advise that somebody maximum should sit for a period of 1 hour. Okay? After 1 hour, stand, stretch a bit. There are some stretches that we usually advise, and then which can take something like 5 minutes or 4 minutes. Sit back for another 1 hour, repeat the same. If you go on doing that, the amount of loading you put onto the spine will be broken, and you will not have back pain. Secondly, is to be taught. There are some exercises we usually teach. What can you do at the end of a long day when you are at home? There are some simple exercises, especially for the back, that we can give you if you have started having pain. And also, we also advise a lot of physical activity, aerobics, even within our home. It could be within your room. That was very important, because usually what brings about the pain is one group of muscle becoming weaker, while other groups of muscles are becoming more stronger. And you have imbalances into this muscle activity, and this predisposes a lot of uneven loading onto structures that cause pain. The other area that we are going to be looking at, especially when we are looking at back pain, is the myth. We've talked of sex and then back pain. Very many people have been agitating that if somebody stays long without sex, yes, it is predisposing this person to back pain, which is not true. It's usually the postures that these people will adopt that will predispose them to back pain. The other area that has come up in recent literatures is what we call the central sensitization of pain. What is central sensitization of pain? This is when we think of things that are not actually real to be the chief cause of a back pain, and then it gets deep-rooted into our brains. Even if somebody talks about the true causes, because the other one is deeply rooted into our brain, we shall always consider to be the chief cause. So sometimes, for example, if somebody says, if you bend for these hours a day and you feel pain, it means that bending would have brought about pain within the spine. The spine is designed to move, and once there is pain, it means either the movement has been done awkwardly, or there is unequal distribution of forces within the spine, and we need to normalize that. This person should not take it into his mind that because I bent, that was the chief cause of the pain, and that's what we call central sensitization of pain. So if we avoid all that, then we can keep a healthy lifestyle. We can have healthy spines that can equally distribute weights onto the different parts of the pelvis, and then we shall move away from developing low back pain. Now, the other area concerns our people who are within the low areas, who do excessive work for long periods of time. Take an example of somebody who moves out from home at 7, goes, digs up to 1, takes lunch for 1 hour, goes back at 3, and then leaves the garden by 6. Now, that one, you are doing excessive loading onto your structures. The amount of work you are giving the body, you are overstraining the body. And that is what could predispose the body onto back pain. So we usually offload some of that work from them. Do for a certain period of time, have some good rest. And then some other people don't rest. One of the other things that has been found to be important is sleep. The question is, how many hours of sleep do we have in a day? Even as people who are involved in academia, people who are in administration, people who are involved in our local work, the question is, how many hours do we sleep? It's very important that the body reorganizes itself very well when we have a certain number of hours that we usually sleep. Each age has a categorical number of hours we are supposed to be sleeping. But minimally, we are supposed to be having between 7 to 8 hours of sleep. But most people have 3-4 hours of sleep. That means that you don't allow this body to reorganize, the brain to reorganize the body, to remove the toxins that have been generated during the active times of the day, so that you wake up with a fresh mind. So sleep also plays a very important role when it comes to good health habits that we usually adopt. Now, all these are all embroidered within the physiotherapy practice, and when we are dealing with the patients, these are all things that we usually look at and we deal with. We also do a lot of health promotion. Health promotion is advocating for good health habits, whether at our place of work, whether it is at home, and this includes diets. What are we supposed to be feeding on? What are we supposed to be doing, especially in regards to exercises? What are we supposed to be doing in regards to sleep? And then how socially are we supposed to take ourselves? All that is embroidered within health promotion, and we usually a healthy body and a healthy mind. So it is easier to prevent some of these conditions I've been talking of briefly by engaging in physical activity, which do not cost. Very simple, but you would have prevented a number of conditions from happening. Thank you very much. And I think that is the brief background what physiotherapy entails and some of the things that we usually do within the physiotherapy practice. Good afternoon, everyone. My name is Kazibo Haman. I'm a physiotherapist by profession, but
you're watching AYIT TV.